Hello everybody, in this video I'm going to talk about a drug of angiotensin converting enzyme inhibitors, which is Benazepril. Just to memorize these drugs, angiotensin converting enzyme inhibitors are commonly used to treat high blood pressure, heart problems and more. They also help in the relaxation of veins and arteries to lower blood pressure. They prevent an enzyme in the body from making angiotensin II, a substance that narrows blood vessels. This narrowing can cause high blood pressure and forces the heart to work harder. Angiotensin II also releases hormones that raise blood pressure. Actually, we have many examples of these drugs. We have Benazepril, Captopril, Enalapril, Fosinopril, Lisinopril, Moxipril, Perindopril, Quinapril, Ramipril, and Trandolapril. In this presentation, as I said, I'm going to talk about Benazepril. First of all, I'm going to give a background and talk about the indication of this drug. Actually, benzapril is a small molecule. The chemical structure of this molecule is C24, H28, N2, and O5. Of course, here the numbers represent the number of atoms within its structure. C is for carbon, H is for hydrogen, N is for nitrogen, and O is for oxygen atoms. So this molecule represents a medication that is used to treat high blood pressure or hypertension, congestive heart failure, and chronic renal failure also. It may be used alone or in combination with thiazide diuretics such as hydrochlorothiazide or calcium channel blockers such as amlodipine. Upon cleavage of its ester group by the liver, benazepril is converted into its active form benzaprilate, a non-sulfhydryl angiotensin converting enzyme inhibitor. Now about the most common brand names of this drug. First of all, we have Lotensin, which represents the salt of benzapril hydrochloride. We have actually 4 doses of this drug, which are 5, 10, 20, and 40 mg or milligrams. We also have Lotensin HCT. Actually, HCT is an acronym, stands for hydrochlorothiazide. Here we have a combination of benazepril hydrochloride with this active ingredient, which is hydrochlorothiazide or HCT. Here we put this type of diuretics to ensure that we can treat renal failure types and renal disorders. Actually, we have 4 main doses. The first number is for benazepril, and the second is for hydrochlorothiazide. We have 5 over 6.25, 10 over 12.5, 20 over 12.5, and 20 over 25 mg. We have also other combination, which is with amlodipine. Amlodipine is one of the calcium channel blockers, and here this combination can be referred to as Lotrel. This drug can be used for those who are suffering from hypertension. The first number stands for amlodipine, not benzapril. Here, the second number stands for benazepril. Actually, we have all of these doses. We have 2.5 over 10, 5 over 10, 5 over 20, 5 over 40, 10 over 20, and 10 over 40 mg or milligrams. Now about its pharmacodynamics. Benzapril actually is a prodrug which, when hydrolyzed by esterases to its active benzaprilate, is used to treat hypertension and heart failure, to reduce proteinuria and renal disease in patients with nephropathies, and to prevent stroke, myocardial infarction, and cardiac death in high-risk patients. Benazepril and benzaprilate inhibit angiotensin-converting enzyme in human subjects and also in animals. ACE is a peptidyl dipeptidase that catalyzes the conversion of angiotensin I to the vasoconstrictor substance angiotensin II. Angiotensin II also stimulates aldosterone secretion by the adrenal cortex. Actually, I talked about the mechanism of action in general of these drugs. Now I'm going to rephrase this mechanism of action for benzapril and its active metabolite Benzoprilate. Okay, so benzoprilate, as I said, it's the active metabolite of benzopril. Uh, it competes with angiotensin 1 for binding at the angiotensin converting enzyme by blocking the conversion of angiotensin 1 to angiotensin 2. Inhibition of ACE results in decreased plasma angiotensin 2. As angiotensin 2 is a vasoconstrictor and a negative feedback mediator for renin activity, lower concentrations result in a decrease in blood pressure and stimulation of baroreceptor reflex mechanisms, which leads to decreased vasopressor activity and to decreased aldosterone secretion. About the absorption of benazepril, actually the bioavailability of oral dosing is 3 to 4% in horses. In humans, at least 35% of oral benazepril is absorbed and reaches peak plasma concentration in about half to 1 hour. Other studies have shown a peak plasma concentration at a median of 1.5 hours or 1 hour and a half. About its volume of distribution, the final population pharmacokinetic model in one study estimated the volume of distribution to be 203 plus minus 69.9 liters. Now about protein binding property. Benzopril is 96.7% protein bound, while benzoprilate is 95.3% protein bound. Now what's about its metabolism? Actually, cleavage of the ester group, primarily in the liver, converts benzopril to its active metabolite benzoprilate. Benzopril and benzoprilate are conjugated to glucuronic acid prior to urinary excretion. About its route of elimination, benzopril and benzoprilate are cleared predominantly by renal excretion in healthy subjects with normal renal function. Non-renal, such as biliary excretion, accounts for approximately 11 to 12% of benzoprilate excretion in healthy subjects. The half-life of the prodrug benzapril is 2.7 plus minus 8.5 hours. The half-life of the active metabolite benzoprilate is 22.3 plus minus 9.2 hours. The accumulation half-life of benzapril is 10 to 11 hours. Now about the clearance, just to memorize that the clearance, which is measured by liter per hour, is the division of elimination rate over the concentration. Okay, so the elimination rate of the drug is measured by milligrams per hour. The plasma drug concentration, which is the concentration of the drug in blood, is measured by milligrams per liters. So here the clearance will be the unit of this clearance is liter per hour. Okay, the final population pharmacokinetic model of one study estimates that the clearance of benzopril is about 129 plus minus 30 liters. And move to the toxicity, adverse and side effects of benzopril. Actually, the most common adverse effects include headache, dizziness, fatigue, somnolence, postural dizziness, nausea, and cough. The most likely symptom of overdosage is severe hypotension. Now I have some warnings, precautions, and tips for patients who are taking or plan to take benzapril. First of all, to reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including fainting, symptoms of a high potassium level blood such as muscle weakness, slow or irregular heartbeats. Although benzapril may be used to prevent kidney problems or treat people who have kidney problems, it may also rarely cause serious kidney problems or make them worse. Your doctor will check your kidney function while you are taking benzapril. Tell your doctor right away if you have any signs of kidney problems, such as a change in the amount of urine. This drug may rarely cause serious, possibly fatal liver problems. Get medical help right away if you have any symptoms of liver damage, including nausea or vomiting that doesn't stop, loss of appetite, stomach or abdominal pain, yellowing eyes or skin, and dark urine. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. This drug can cause serious harm, possibly fatal to an unborn baby if used during pregnancy. It's important to prevent pregnancy while taking this medication. Consult your doctor for more details and to discuss the use of reliable forms of birth control while taking this medication. If you are planning pregnancy, become pregnant, or think you may be pregnant, contact your doctor right away. This medication passes into breast milk. Before taking Benazepril, tell your doctor or pharmacist if you are allergic to it or to other ACE inhibitors, such as lisinopril, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially the history of an allergic reaction which included swelling of the face, lips, tongue, throat, angioedema, blood filtering procedures such as LDL, apheresis, dialysis, high level of potassium in the blood. This drug may make you dizzy or drowsy. Alcohol or marijuana, cannabis can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Limit alcoholic beverages. Talk to your doctor if you are using marijuana, cannabis. Severe sweating, diarrhea, or vomiting may cause dehydration and cause you to feel lightheaded. Tell your doctor if you have severe diarrhea or vomiting. To prevent dehydration, drink plenty of fluids unless your doctor tells you not to. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This product may increase your potassium levels. So, before using potassium supplements or salt substitutes that contain potassium, consult your doctor or pharmacist. Older adults may be more sensitive to the side effects of this drug, including dizziness and increases in potassium levels. Do not share this medication with others. Lifestyle changes such as stress reduction programs, exercise, and dietary changes may increase the effectiveness of this medicine. Talk to your doctor or pharmacist about lifestyle changes that might benefit you. Lab and/or medical tests such as kidney function, potassium levels should be done while you are taking this medication. So keep all medical and lab appointments and consult your doctor for more details. Check your blood pressure regularly while taking this medication. What can you do if you forget to take your daily dose of this drug? Okay, I'm going now to talk about the missed dose. I have many situations. First of all, if you miss a dose, take it as soon as you remember. But if it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time and do not double the dose to catch up. How can I store this medication? Now, about its storage, store tablets at room temperature away from light and moisture. Store the suspension in the refrigerator. Discard any unused suspension after 30 days. Do not store in the bathroom. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company. Now about the interactions of this drug. Actually, to be honest, Benazepril can interact with hundreds of drugs. I will talk about the most common and serious interactions. It can interact with aliskiren, sacubitril, and lithium. Some products that may interact with this drug include certain drugs that weaken the immune system or increase the risk of infection, such as everolimus and sirolimus. The second category of drugs that can interact with this drug are the drugs that may increase the level of potassium in the blood, such as ARBs or angiotensin receptor blockers, including losartan and valsartan. Birth control pills containing drospirenone also can interact with this drug. Some products have ingredients that could raise your blood pressure or worsen your heart failure. Tell your pharmacist what products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs or non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen. A very serious reaction may occur in those getting injections for bee wasp sting allergy, desensitization, and are also taking Benazepril. Make sure all your doctors know which medicines you are using. Thank you all for watching. The following video is going to be about the second drug of this category or of this family, which is captopril. Wait for me and please like and subscribe for more videos.